Hello, my name is Alison, and I want to welcome you to this second episode of the FIP CPD Bite series, Beyond Medication, Strengthening Trust, Empathy, and Loyalty in Pharmacist-Patient Interactions. This particular episode is focused on fostering loyalty. In this episode, we are going to explore how effective communication contributes to, fostering long-term loyalty in pharmacy practice. And we'll consider also the impact of positive patient experiences and how they influence whether patients return, seek further guidance, or recommend pharmacy services to others. And then finally, we'll look at what drives loyalty in the context of minor ailment management, including how pharmacists can create meaningful patient-centered interactions that go beyond their immediate clinical needs. Before we begin, let's take a moment to really reflect on the core human values that shape pharmacist-patient interactions. Among the very many important human values that you can see on this slide, we will focus this CPD Bite series on trust, empathy, and loyalty. And in this episode, we will really focus on loyalty, a value that reflects a patient's trust, confidence, and continued connection with their pharmacist. Loyalty is really nurtured through positive, consistent experiences where the individual feels heard, feels respected, and is supported in their healthcare decisions. And loyalty is not static, it grows. It really grows when the pharmacist offers reliable guidance, personalized care, and a genuine commitment to their patient's well-being. So as we move forward through the CPD Bite, you will discover how small everyday actions like following up on patients' progress, or even, encouraging patients would really cause them to improve their loyalty to the pharmacist and return for ongoing pharmacy advice and services. So just to acknowledge that while this episode focuses on loyalty, we have the other two CPD Bite episode, which focuses on empathy and trust. And to let you know that all of these are interconnected and they are values that mutually reinforce, our daily pharmacy practice. Throughout this episode, we'll explore why patient loyalty matters in everyday pharmacy, particularly when supporting patients with common ailments. We'll also explore the impact that this positive patient experience has on, patient loyalty. And then we'll use a scenario and highlight simple, effective communication techniques that pharmacists can use to build meaningful, lasting connections with their patients. Just a bit of disclaimer that this scenario presented in this video is just for demonstration purposes only. So it's intended to highlight communications and social skills in pharmacy setting. It doesn't take into account all the full range of clinical and non-clinical factors that a pharmacist or a pharmacist technician must consider when conducting, a comprehensive patient assessment to make appropriate recommendations. So let's take a look at a scenario. A woman comes into the pharmacy asking for something for hay fever. She has also recently started using a new skincare product. Now, as the pharmacist, how would you approach this interaction to build patient loyalty? This is a very valuable moment to consider how we support patients when they are unsure and looking for clarity. What would you say? How would you ask questions? How can your words, how can your tone and your presence make this patient feel heard, cared for, and confident to return? So what we are going to show you now is a scenario where there is a missed opportunity, a moment where Ben, the pharmacist, could have built patient loyalty, but instead the interaction fell short. Let's take a look at what happened. It was a very typical busy day at the pharmacy. Sarah, a young adult, walks in, hesitant and unsure. She says she thinks she might be having hay fever again, but also mentions that her eyes and her skin feel really strange. It's a moment that calls for curiosity, reassurance, and personalized support. But Ben, the pharmacist, feeling the pressure of the day, it's a busy day, responds quickly and in a rushed tone. Ben brushes off the details and points Sarah's towards the antihistamine section of the pharmacy, without further questioning or considerations. Although the advice may not be necessarily wrong, because Ben, Sarah needs antihistamines, but the lack of engagement, follow-up, and the reassurance can leave Sarah really uncertain, possibly confused, and unlikely to return for advice next time. The interaction ends with Sarah saying, "Well, okay, I guess I'll try that one," you know, and that's it. So what was missing in Ben's approach, and how could a small change in communication have made Sarah feel more supported and more likely to return? In this missed opportunity scenario that we've talked about, we can identify several reasons why this was a missed opportunity to foster patient loyalty. First of all, Ben assumed the cause of the symptoms without listening fully. The patient mentioned something unusual, a combination of eye and skin reaction. Yet, this wasn't explored further by Ben, the pharmacist. Secondly, there was also no follow-up or clarification. No questions to better understand the situation, no space given for the patient to express their concerns in details. Importantly, there was no attempt by Ben, the pharmacist, to explore other possible causes of this experience that Sarah was having, such as a skin care reaction, even though the patient had hinted at that possibility. The advice was very generic, it wasn't personalized, and it offered no reassurance to Sarah, a key component of making patients feel cared for and understood. So as a result of this, the patient left with uncertainty, unsure whether her concern was taken seriously, and with no clear, direction or reason to return. This makes us to really know that fostering loyalty means taking time, even if it's briefly, to engage, clarify, and connect with the patient. In this case, those opportunities were missed. Now, the importance of patient loyalty in pharmacy practice can't be overemphasized, okay? Patient loyalty can have a great impact on the outcome of the patient, particularly for those with common ailments such as heartburn and allergies. We also have that patient loyalty, it builds a long-term trust and satisfaction in the care that the patient receives. Loyal patients are more likely to communicate openly and report their symptoms accurately. These loyal patients are also less likely to rely on misinformation or engage in self-mismanagement. Over time, they show better adherence to treatment and self-care recommendations. So repeat visits strengthens continuity of care and reinforce the patient-pharmacist relationship. It's important to note that consistent, respectful interactions are remembered and valued by patients. So what are the key techniques to engage patients meaningfully in their care and encourage active participation? We could, use open-ended questions such as, can you tell me more about how this has been affecting you? Or what have you tried so far and how did that work for you? Just give them an opportunity to talk more so you can get as much details as possible to inform, your recommendations. Now, we also want to, while they're talking, demonstrate active listening, such as, paraphrasing what the patient is saying or summarizing or reflecting back just to show that they are being heard. So you could say, so what I'm hearing is that you have been managing this for a while, but they are still uncomfortable. Is that right? The other thing is really one of the values that we are discussing in this series, and that's empathy. So showing empathy and curiosity without judgment and validating the patient's concerns, it really makes them, feel seen, and finally encouraging a shared decision making, rather than just saying, look, this is all that you need to know, take this and you'll be fine. You could say something like, here are a couple of options. Okay, let's look at what feels right for you. And then we discuss together, involving the patient in the process of decision making. To meet the specific needs and preferences of individual patients, pharmacists can also adjust for three things. First of all, everyone has their respective health literacy levels. So the pharmacist needs to adjust for the literacy and language level of that patient, using plain terms, confirming understanding without judgment to help you adjust better for this literacy level. The other thing is being respectful of the individual preferences, by asking For example, would you prefer to have this conversation here? Would you, prefer I explain this verbally or in writing? All of these just shows the patient that you're thinking about all that needs to work in order for them to receive the best care possible. We also want to show cultural sensitivity and not just make assumptions, use very inclusive languages and all of that. To encourage openness, pharmacists can also frame questions to reduce judgment. So instead of saying, did you forget to take your medication? You can say, many people forget to take their medicine sometimes. Has this happened to you? That way they see themselves like, it's not only me, it happens to a lot of people, And we could also use like non-verbal cues like nodding, mirroring their expression and, eye contact just to really encourage openness. And rephrase and repeat gently. If you ask the question and the answer was really vague, you could try asking, differently. But in all of this, remember to always reassure about confidentiality and provide privacy when needed. We know that pharmacy practice is without its own challenges. So some challenges that can be faced when trying to engage with patients. As you can see on the slide, we have the first one is the patient withholding information. And what can we do without them sharing that information? We really can't do much. But you can address this by really creating that safe space and affirming confidentiality as well, making the patient feel more comfortable. We also have, like in Ben's case, the time pressure at the pharmacy. So a lot is going on. There's so much patients to attend to. There's not enough time. We can address this using a very focused yet empathetic communication to ensure that we are being efficient in the time that we allocate to each patient at the pharmacy, And the third one is the patient being embarrassed or fear of being judged. This can also be addressed by normalizing consent and, acknowledging the patient's emotions, by showing compassion, by showing understanding. The other thing is misunderstanding treatment, which can be overcome by adjusting for their literacy level. You could also use like visual aids and checking for clarity just to really help you adjust for the literacy level to make sure that each patient really understands the information and treatment option. The fifth challenge is pharmacist assumption. And I mean, this is one thing that we saw in the scenario with Ben, asking before advising and letting the patient lead often help us pharmacists to get a clearer perspective of the patient's concern. So now let's take a look at this scenario and how it could have been approached more effectively. One of that, that fosters a sense of trust, of care, and ultimately patient loyalty. So you're welcome to pause and read the conversation that happens here. Now we see in this scenario now that pharmacists then greets the patient with a more warm tone and open body language, creating a space that feels safe and supportive. So rather than jumping to a conclusion, Ben responds with, let's figure it out together. A small phrase that immediately signals, partnership. Ben also follows with open-ended questions, showing curiosity and attentiveness. Ben listens carefully as the patient mentions using a new face cream. This is an important clue that could have been easily overlooked. Instead of offering a quick solution, Ben now takes the time to ask a series of other questions to understand the patient's condition and to explore possibilities. Ben explains their reasoning and involves the patient in the decision-making process. So this interaction, it's more patient-centered, it's respectful, and it's supportive. These are exactly the types of moments that keeps patients coming back. It's not just about solving the health concern, but about how the patient was made to feel during the process of solving that health concern. The patient now feels listened to, the patient feels involved, and the patient feels genuinely cared for. These scenarios now highlight several key strategies that can help foster patient loyalty through everyday interaction. First, the patient feels heard, not dismissed. That alone can shift the entire tone of the consultation. When the patient feels that they are genuinely listening, they are more likely to trust the advice we give as pharmacists and to return in the future. Second, the pharmacist has shown interest and has demonstrated reassurance, not just focusing on the symptoms that the patient is presenting or is talking about, but on how the patient feels about the symptoms. This builds a connection that goes beyond clinical exchange. Next, the advice given is clear and is tailored to the individual. So rather than offering a one-size-fits-all response, The pharmacist considers the patient's specific conditions, including the possible skincare reactions, and offers a personalized option. And finally, this approach builds trust and encourages return to the pharmacy. Whenever a patient feels safe or feels understood and supported, they are not only more likely to follow the advice that they are given, but they are also more likely to come back to the pharmacy for future care and guidance. In this scenario, what really made a difference between the interaction that Ben had prior and the one we've looked at now is that in the missed opportunity, the approach was rushed and dismissed. It was really transactional. There was no effort to clarify, and the interaction felt transactional, no empathy or reassurance offered. But in the improved version, we see that Ben took the time to explore the full symptoms picture, asking thoughtful questions, open-ended questions, trying to understand the situations more clearly. Ben offered reassurance, explained the options carefully, and involved the patient in the decision-making process. And all of this builds trust. They may look small, okay? But these are important actions that help shift the interaction from being a transaction to being relational. This kind of engagement fosters loyalty and encourages patients to return. In summary, fostering loyalty is not transactional, it's relational, okay? Pharmacists build loyalty by, first of all, listening without judgment, involving patients in decision-making process, respecting the patient's experiences and the patient's value, and finally, creating a space where the patient feels safe to share. The goal is to foster loyalty in order to have patients who return, not just for medicine, but for guidance and for care. The key takeaway in all of this is that loyalty is built when patients feel their concerns are taken seriously and their needs are met with care and attention. So thank you so much. Finally, we'd like to highlight, the FYP Knowledge and Skills Reference Guide for Pharmacists Supporting Self-Care. And this guide adapts the competencies and behavioral statements from the WHO Self-Care Competency Framework. It is designed to support pharmacists in developing the essential knowledge and skills needed for effectively advocating and also delivering patient-centered self-care interventions. In particular, this one focuses on competencies required to strengthen communication and shared decision-making with patients, as outlined in Domain 2 and 3 of the document. So feel free to scan this QR code to access this document. And thank you. Here are the references. Thank you so much for listening.